A lot of people might ask about who should come see a psychologist, who would be appropriate for a psychologist to see. Historically speaking, a clinical psychologist is somebody who focused very much on severe mental illness, and that's because the role was created to help psychiatrists deal with a much bigger caseload than they were able to handle. But over the years, that has broadened out and the scope is much greater now. So we still do treat people who have diagnosable mental illnesses, and that's an important part for coming to a psychologist is because you need to get better. But also we really believe in prevention over intervention. So for those that feel that they're getting to a point where the stresses of life, the stresses of day to day, their coping strategies, the relationships that they get into, all can cause difficulties that people are trying to navigate. And when they start to feel like things might be getting a bit much, or if there's been a major change in their life and they're just not sure how to navigate, coming in and talking to a psychologist can be very helpful and can prevent that slip into that darker place. Something that's very dear to me is the idea of breaking the stigma behind not only mental illness, but also seeing a psychologist and what that means personally. I think there is a lot of misconceptions about what it means to be mentally ill. We do know, and very popular statistics, is that 1 in 4 people will suffer with a mental illness at some point in their life, and that's a huge number. But what it means is that it is very, very common. There is a shift that's happening now between people starting to recognize that mental health is just as important as physical health and needs to have the same priority and the same focus within healthcare systems in general. I think that helps make people more comfortable with the idea that they can see a psychologist without it meaning that they definitely need to be diagnosed with something or having some label that's going to have implications longer term than that. By seeing a psychologist before your symptoms become so difficult that it interferes with your life, you might be able to get a handle on some basic coping strategies and techniques that work for you and are much more preventative in nature, where you never end up developing these full-blown diagnoses. So a clinical psychologist can be very similar to what a counselor has to offer. Again, the differences come down to amount of training that the individual has had, and it also comes down to the kinds of treatments that that individual has had training in. There's so many different types of therapy techniques that are available. I personally was trained in a psychodynamic sense, which means that it is a theory that looks at longer term ways of relating, ability to understand your own defenses that can pop up in different scenarios, your ways of understanding the world around you, and the way that you view your relationship with others, for instance. These are all things that could have been solidified earlier in childhood or through traumas along the way. And this is a much more of an exploratory approach that helps people have a real understanding of who they are and why they interact with the world in the ways that they do. For some people, they really want to get to these root causes of their own psyche, in which case that might be appropriate for them. For other people, there's a different kind of shorter term, solution-focused kind of therapy treatment, and ones that are much more focused on the present rather than reviewing things from the past. Cognitive behavioral therapy is one that has a lot of support within the literature, and of course is very popular in the media. And that's just a technique that's looking at the way that you think about things and then the emotions that follow and the behaviors that all interact. And it's having a very good look at this interaction to see if there are different options for relating that might help make change. Within psychology, when somebody comes having had a medical diagnosis or undergoing medical treatment that has created great changes within them, there's a few things that we can do. One is we do look at the emotional strategies that they're using to help them make meaning of what's going on. It is possible that there's going to be set goals that have maybe been identified by a physician or a consultant with which must be achieved. A psychologist can help with motivation and goal setting. For instance, somebody who is suffering with obesity or a heart condition, maybe they might be working downstairs with some of the outpatient physios, but are finding their commitment to that kind of exercise or the diet plan is very challenging. So they can come see a health psychologist to work through what are the motivating factors that we can really harness, or what is the specifics that we can do day in, day out, or week on, week off, that helps them commit to the changes that they have to make, which will be full lifestyle changes that they need to commit to in order for their own physical well-being. Mindfulness is a fantastic skill that is often not fully understood with the way that the media portrays it. And it can be quite complex, and yet it can be quite simple at the same time. So part of the therapy could be exploring some of these other newer versions of treatment to see what might be most effective to the person who comes in. Now, because I've had different training and supervision and experience across a whole broad range of these therapies, what it means is that when an individual walks into the room, I can work quite collaboratively with them to try to identify what works best for them. The patient might not have any idea at the time what kind of treatment they're looking for, but by going through some of the different approaches and getting to know that person's personality, we normally can come up with something, try some things out, see what works, see what doesn't. I'll get the feedback, and we can develop a really tailored approach to help them tackle what it is that they're hoping to achieve.